Hey y'all out there on the internet. I wanted to give an update on my health condition and things I learned today, and I'm going to show you them on x-rays dated almost 4 months ago. So today I saw a doctor at Northern Colorado Spine and Orthopedics, and he basically confirmed what I've been suspecting and have mentioned to all my other orthopedists for months that I have a tibial non-union and that the rod in my tibia set about, it's like 1 to 2 centimeters too high into my knee, causing pain by pressing into the fat pad behind my femur joint. He told me that the only fix is surgical, and he specifically recommended using an RIA, a Reamer irrigator aspirator machine. That they don't have it at that site because it's too expensive and specialized. So he's going to refer me to the University of Colorado School of Medicine, as it's one of the few places that has it. I'll show you 4 x-rays in a minute. First one will be a front view of the knee. Second will be a side view of the knee. That's the one you'll end up seeing that shows the rod extending about 1 to 2 centimeters into my knee and irritating its fat pad. The third one is going to be a front view of the ankle, and the fourth one will be a side view of the ankle. You're going to see on the second and fourth x-rays where the tibia is calloused over on the top side and the bottom side, which is a clear sign of non-union. He explained that when they use the RIA machine, what they'll do, and I'll point it out, is they're going to remove 4 screws holding the titanium rod. They actually call it an intermedullary nail, but it's a titanium rod for us laymen's. They're going to be 2 nails, 2 at the top of the knee, and then 2 near the ankle. They're going to reopen the scar at the top of it's on the top of my femur, to insert the RIA machine. And then it's going to ream around the old rod, and it'll remove it, but it'll also stimulate new bone growth and prepare it for a larger titanium rod. Hopefully it'll give the fracture the chance to heal. You'll also note that on the x-rays I'm going to show you in a minute, they're all dated 6/17/25, and today's date is 10/9/25, almost 4 months. I had mentioned these at all of the earlier appointments, and I was told that they would be fine and it would heal. And then since then, I've asked to see both a knee and an ankle specialist. My ankle issue stems from the fact that I had a compound fracture of both the tibia and fibula, and it tore what's called an interosseous membrane. It also has in it an interosseous ligament, and that holds the tibia and fibula around the ankle joint, so it doesn't compress correctly around my ankle anymore. It also happened that the membrane part contains nerves and blood vessel channels, and so it damaged them. And then due to that, I now have to wear a grade 3 ankle brace, probably for the rest of my life. All the other doctors did actually admit that it was probably a non-union, but that it was outside of their specific orthopedic specialty. So I had to go today to see a specific fib orthopedic, and he was the first to technically directly address that exact issue. So the bad part is, unless I can convince my employer to extend my leave of absence, or if they can move me into an office role, I'll lose my insurance by the end of the month. So if anybody out there feels moved enough to donate to my GoFundMe, I'd be incredibly grateful for it. And if you can't, please share it. It actually it helps just as much. The exposure can put my face in front of somebody that can donate. God bless all of you. All right, so this is the first x-ray, and so they'll cut 2 small spots and remove these 2 screws. I'm going to skip over to the third x-ray, and they're going to remove these 2 bottom screws. This is where you can see that it absolutely, here's a little gauge, extends about 1 to 2 centimeters. It's about 1 centimeter in the back to 2 centimeters toward the front of the knee. And when my leg straightens, there's a fat pad right there. You can kind of tell right here. There's a reason it's mildly more opaque. It's swollen, and that's what water does to x-rays. But anyway, also on x-ray 2, you can see that this is calloused over and this is calloused over, and the backside same. Yeah, I mean, you can actually, this is where it's callousing together. See how it's slightly grayish? That's what you would be expecting. See the slight grayness? You would be expecting that black line to disappear. But because it's not, and that grayness actually is interned. I don't have the x-rays from today, but so they'll have me bend my knee 90 degrees. I'm going to take this scar and reopen it. They'll then ream all the way down here after they remove these 2 screws as well. You'll see them right there. They'll ream it out, and then they're going to pull that rod, and then they're going to put a new one in. Make sure that they're perfectly lined up again. And well, he informed me that this is going to be a long healing process anyway, especially since it's a redo. All right, and there's the proof 617. All of them have slightly different times, but they're very closely related. And that's who did the x-rays down there. So, yep. God bless